Good morning, everyone. I'm Mark Zimmerman, a board member for EDPNC and the Senior Vice President of External Affairs for the North Carolina Realtors. I want to take just a moment before we get into this introduction and echo Dan's thanks to the North Carolina Electric Cooperatives for being one of the sponsors for this event, and remind everyone that we had two other sponsors, First Bank and the North Carolina Bankers Association. Without their generous support, none of us would be sitting here getting all this great information. So if you see them around the room, please thank them as well. I'm pleased to introduce the speaker in our next building block, which covers health. Maggie Sauer is the Director of the Office of Rural Health at the North Carolina Department of Health and Human Services. Maggie will be discussing the ties that bind health, education, and economic development together. Please join me in welcoming Maggie Sauer.
I want to start out by just saying thank you for this opportunity to be here and have the time to speak with you and engage you in your thoughts and so on around this topic. It's so important. It's something that is near and dear to my heart. I told Kelly, I said I get really excited about talking about rural communities and the role that they have in our state and in our nation, because I grew up in a rural community and I'm so intensely committed to the work that they do and the opportunities that they bring. So really happy. I want to call out to my partner, Patrick Woody at the Rural Center. We do a lot of work with them across a number of different activities. And I can't tell you how important it's been to learn from Patrick and from other people around the state about how we can do this work together and how important it is to not stay within our healthcare silos and think more broadly about what we can do together as a community, and most importantly, that the community is the one who helps us understand what we can do to be helpful with you. So again, I just really want to thank you for everything that you're providing to help us think through this. I also want to say thank you to table 15 and 16, because I now have a lot of additional notes. I wasn't going to bring this up. I wasn't going to bring this up with me, but I was like, oh my gosh, I've got all these things I need to talk about because of what I've been talking about with you guys for the last 2 days. So thank you to table 15 and 16. Just one thing, I just wanted to tell you a little bit about the Office of Rural Health. We have the oldest Office of Rural Health in the nation. We were the first Office of Rural Health in the nation. And it started when Governor Holshouser and Jim Bernstein said, wait a minute, we have got to make sure that our rural communities and their health care are addressed. And we can only do that if we do it in engaging ways with the community. So this year, we will be celebrating our 45th birthday. And I will let you know that, again, North Carolina is a leader because we were the first Office of Rural Health. And after other states saw what North Carolina was doing, everybody now has an Office of Rural Health. So I think that's something that all of you can hold up and be very, very proud of. So some of the things, just quickly, that we do at the office. We have incredible support at the state level for many, many of the things that we do. One of the things that we do is provider placement. And what that means is that we work with local communities and local practices and local hospitals to help them recruit and retain healthcare providers. And part of the way that we do that is because the state makes $1.5 million available every year for medical school loan repayment. So many of you have heard about the fact that people leave school with, I mean, $200,000 is nothing at this point. I mean, that's a lot of money, but I never thought that I would hear that some of these folks are leaving school with $300,000 and $400,000 worth of medical school loan. And that's tough. That's really, really hard, because when you're trying to help people think about practicing in smaller communities where they're not necessarily going to make quite as much money, then we need all the help we can get to help them think about going to rural communities, staying in those rural communities, and making it worthwhile. So one of the things I wanted to focus on with these services is the fact that it's not just about loan repayment. You've heard kind of all the last 2 days, it's not just about the money. It's also about the quality of the lifestyle that people have there. We'll talk about that in just a minute, but it's all of you, truly, in this room, who are engaged in helping people feel proud and good about wanting to raise their families in these communities and staying in those communities. So we have data that actually proves that. So we have questionnaires that we ask people when they come and when they leave. You know, what is it that makes you decide you want to come and stay? And that is because the community embraced us. We feel important. My family feels safe. We feel good about being here. So all of you play a huge, huge role in why people decide to come and why people decide to stay. The other things that we do are around community health grants. Our office is primarily set up to provide access to care for folks across the states, primary care access. So we fund a lot of projects across the state that do that. We do a lot around just kind of overall health. We do a lot around looking at what is needed where in different parts of the state in terms of availability of services. We also do a lot around health professional shortage areas. So some of you may or may not know that your counties have a certain health professional shortage area designation. The higher it is, the more likely it is that you're going to get some sort of special acknowledgement or support to recruit healthcare professionals in your area. So HPSA designations are really, really important. And so we try to work with folks around that as well. So just with regard to the reach, I look at this as the Office of Rural Health. We are your Office of Rural Health. And so when you look at the spread across the state, you can see where some of our different programs are. We work with hospitals. We work with safety net organizations. You'll see on there also there's a special designation for placement services where we've actually placed physicians and worked with practices and so on. I will tell you also that of all of the projects that we are able to support because of the money that the legislature gives us, those are typically jobs that are typically projects that generate jobs. So if we set up a community health center site, if we set up a rural health center site, if we set up a free and charitable clinic or we provide assistance to that, those dollars generally result in jobs in that community. And if you go to the website, you'll see the return on investment, because we believe that that's important. It's not only an investment in just the healthcare, but it's an investment towards the entire community. So just a little bit about me from my vantage point. I am a country girl. So I grew up in eastern Colorado out on the plains. So our ranch was 15 miles outside of town. And so if you look at these slides, that road in the middle of the page is looking straight into town from the road we traveled every day to get into town. So what I always say is that I love living in North Carolina because there's lots of trees. And every time I see somebody cut a tree down, my heart sinks. Because there are not a lot of trees out there. I also think about how the community grew. And down in that left-hand corner, you'll see there's a picture of President Roosevelt, Teddy Roosevelt, when he came out west. Because my family got out west because of the railroads. And everybody came from the east to the west because the west was opening up. So there's a lot of cattle growing, there's wheat growth, but up in the very top piece there, what you'll see on that far top left-hand side are windmills. So I put these up there, and then also in the top right-hand corner, there's a prison there. Now, when I grew up, there was none of those things. You looked across the prairie, and it was as wide and blue. And now when you look across the prairie, you see energy being generated. And so I will tell you that those two things, although the prison in town was something that people were really concerned about, because what are we going to do with the prison in town? I mean, Lyman doesn't have that kind of stuff out there. I mean, that's really not what we do. But it helped generate income for the community, and those wind turbines have completely changed the opportunities and the jobs that are now available to the community. So I just provide that as a source of reference. The other thing is Mike Hawkins. There he is. He's my cousin. Did you know that? From a long time ago. My family actually came from Virginia down through Transylvania County. My mom's last name was Hawkins. So we've been going back and forth because I can trace that. I said, Mike, you're my cousin. So I claimed it now as family. So I just bring that up because I do think that what we've talked about here is education. We've talked about changing economies. And I will tell you also that Lyman, Colorado had to change the way they looked at healthcare. Because we had one physician that basically traveled all over the county. And when Dr. Straub left, there was nobody who was going to come out and work like Dr. Straub did. So there was a woman in town who said, I've been a practice manager here, and I think we could put in some telehealth. Now, this is not somebody who had 100 degrees or anything else. She said, it just makes sense to do that. So now Lyman has a telehealth site. And I bring that up from my personal experience. But North Carolina, there are many places where that's happening across the state right now. And that's how we get back to this discussion also around broadband and the importance of broadband, because it completely has changed the opportunities for people wanting to be in that community and wanting to stay in that community. So one of the other things I wanted to bring up to you is that in 2014, the North Carolina Institute of Medicine did a report. It's called the Rural Health Task Force Report. Now, some of you may or may not know that sometimes the NCIOM brings everybody into Raleigh and everybody sits around and talks about what the issues are. In this case, the awesome thing was that they went out across the state to talk to people, not in Raleigh. The important thing is going out and talking with folks about what they think are important issues in their own community. And guess what they said? If you look at this particular model, it says it's a sociological model of health. But basically, what it is they're talking about education and jobs and community leadership, and all the things that work together in a community to make you healthy and to keep you healthy. And they're the ones who put together a list of priorities about what they felt like was the most important thing in their communities. So this is supposed to be about health. And one of the first things they said was small business and entrepreneurship to grow local and regional industries. The second thing was increasing support for childcare. Because you can't go to work if you don't feel like your kids are safe and have a place to be. The third thing was working within informal and formal education systems to develop healthy eating and active living. So in other words, what are the things that we can do to really think about how, as a community, we can be healthy? So I go out across North Carolina, there are all kinds of really creative ways that people are doing that around local food markets, around doing walking trails, looking at opportunities for kids and parents to be in community or in places where they can participate in some of this stuff together. The fourth thing was using primary care in public health settings to screen for and provide treatment around substance abuse, behavioral health care, and so on where appropriate. Because people every day are talking about how behavioral health services and substance abuse services are stymieing their ability to move forward as a community. Because there are folks there who are your friends and neighbors, who you love and you care about, and something happens, they get down the wrong track, and then how do we help them? So really, how can we basically help people within a primary care setting? When I was growing up, the JC's building down the way had is where the psychologists would come to town and spend, a day a month or 2 days a month or whatever. So the psychologist basically, if you saw somebody's pickup in front of that office, you went, Mrs. Jones was down to see the psychologist. I wonder what's going on. So if you have people who can be seen as part of their primary care and have things addressed, that makes a big difference for folks. Then the other thing is just healthcare coverage. Being able to know that if I have to go to the doctor, it's not going to break the bank, and I'm not choosing between providing food for the family or not even just my family, but my extended family. If it's my parents, whatever. And then also being able to recruit and retain health professionals in rural areas. So it's really about how we collectively all work together. And we had a great discussion yesterday when we were talking about education, because we have to, and I think the thing that's great in rural communities, we've had a lot of discussion about the idea there's a lot of untapped potential out there in rural communities. The fact that people care so much and so deeply about their communities and living in those communities is so incredibly important. And so I think, it's starting in, and we've talked about this, if we're going to have a healthcare provider that stays in your community, you need to be able to talk to kids when they're first growing up. This is a possibility. You can do this and you can do that. There's lots of different job opportunities, because one thing we know is that the folks who decide to come and stay in rural communities are generally trained in rural communities. They've come from rural communities, so they're more likely going to stay in rural communities. So it's a recruitment and retention strategy for that as well. So some of the things that we talk about in terms of economic development, recruitment, and retention is overall community satisfaction, the climate, seasonal recreation, housing. All of those things are incredibly important to all of us. And so I think we're now experiencing a time where we're having kind of a boundary spanning. In other words, it's not just about economic development. It's not just about healthcare. We have to be able to talk across these different areas. So just some information for you about how much healthcare can bring to a community. So this is just a small rural health center can bring income of about $500,000 from one physician and that practice. Then when you look at the economic impact of the total rural health center, so we need people who can do practice management. We need folks who can do a variety of things in that practice. And if you look at the overall outcome and the return on investment, it's generally over $1 million that practice returns back to that community. So I think as you guys are beginning to think about what it is that needs to be done and ways of generating income, the basic healthcare infrastructure and why it's important to keep your communities healthy, you have an economic generator with those practices. So one thing is also important is being able to provide healthcare coverage. And so I know there's been a lot of discussion around closing the gap on healthcare coverage. And really, we have about 43,000 jobs that would be created in North Carolina because of that. And when you look at those jobs, primarily a lot of those jobs would go to some of our 44, some of our most rural counties. And in addition to that, when you think about it, rural hospitals. You've heard a lot about hospitals closing their doors. Well, it turns out that a lot of our critical access hospitals have a lot of Medicaid patients or serve a lot of patients who don't have health care insurance. And that will help them keep their doors open. And then it also helps, basically increase the access to care and a healthy workforce. You're going to hear from Nick in a little bit, and you'll hear some of the things he's doing specifically around that. In North Carolina, back to broadband, there's a partnership underway right now with the Land of Sky Regional Council, Mountain West Partnership, DIT, our Office of Rural Health, and Appalachian Regional Commission, trying to think about ways that we can all work together, use that funding to expand broadband to include telehealth that would go into people's homes, as well as telehealth that would expand into employers' opportunities for on-site care and wellness within a job site. Can you think about how often people have to leave work to go take a family member to the doctor? Think about, we had one manufacturer in Western North Carolina that said during the flu season, they had 50% absenteeism because of the flu. Because people had to leave the site to go take somebody to the doctor, to take a family member to a doctor. What happens if we're able to have that person seen virtually? Not replacing what a physician does, but augmenting what a physician does. So when we talk about infrastructure in rural North Carolina, broadband is DNA. There's a Polk County, St. Luke's Hospital would not be open today if they didn't have broadband coverage to provide the 24/7 care that's required in a critical access hospital. That's how important broadband is to these communities. So just quickly, because I know my time is just about up, there's a resource that was developed through the department, and it provides an opportunity for you to go and see, because housing, transportation, food, all of those things are important to the health of our community and people having access to food so that you're not in a food desert, access to housing, etc. So this is a map that was created so that you can actually go and see what that looks like within your region. So you can go to a region, this is a local health department area, and you can begin to drill down and see where these places are where there's need more housing, less housing. I mean, not that you guys know that on a regular basis, but if you're writing grants, if you're trying to help people understand what's happening in your community, this is going to be a great resource for you to do that. So I just want to say thank you, and I'm kind of I don't remember who said this, but somebody said, don't ask me why, ask me why not. And I think that's where we are today, because we can do this. thank you very much.